Hello, everyone. I know a few folks are still joining us, but welcome to those who are on the line to our DEI-focused conversation, which will be on advancing equity to save more lives within the Latin community. My name is Deanna Fenton, Senior Manager of Program Development and Operations here at the Alliance. And as always, it's my pleasure to be here to kick off what I'm sure will be an incredibly valuable discussion. Now, if time permits, I do want to encourage you all to stay with us on the line for an additional 30 minutes so that you'll have the opportunity to engage in an open discussion with our panels and ask and dive a little deeper into some of the challenges that you may have been experiencing in your daily practices. And certainly during this time, our presenters will be available to you to answer any specific questions you may have and just provide some further insight. Now, with that being said, as always, we'd like to encourage you to use this as an opportunity to engage with our presenters. So if you could, please take a moment to locate the chat feature that's located at the very bottom of your Zoom window. Throughout the presentation, you'll have the opportunity to submit any comments or questions you may have in real time to engage with your colleagues and our panel. Additionally, for those of you who may be joining us today as a group, I'd like to ask that you take this opportunity to complete the following poll to indicate approximately how many people have joined your group. Lastly, for those of you who may be interested in continuing education credits, please take note of this slide here, which outlines the credits that will be available for today's program. Following the conclusion of the program itself, you'll receive an email from us with detailed instructions on how to claim your credits. Now, with that being said, I'd like to begin our program by welcoming our moderator, Salvador Guerrero, who I finally got to meet in person just last week at the Alliance's National Critical Issues Forum after many years of working together. So it was nice to have that opportunity. Sal serves as a Family Resource Coordinator at Donor Network West and a member of the Alliance's DEI Committee. Sal, I cannot thank you enough for being with us today to facilitate this conversation, and I'll go ahead and leave it to you to get us started.
Well, thank you so much, Deanna. It was a pleasure meeting you in person and the opportunity to be there for that conference. So thank you so much. And again, I welcome everybody today to this important topic that is apparently has gotten a lot of questions. So I'm grateful. We'll try to answer some of these questions based on the presentation. And again, as Deanna mentioned, that chat box is available to all of us. Again, just to break a little of the ice, just before we go on, if you could practice your chat box and tell me what city or what state are you representing today? And I'll try to mention that as we go on through this presentation. So just to give you an overview of today's presentation, let's start off with in the United States, the Latinx community, especially those that are undocumented, face a significant barrier in healthcare. In this conversation, we will establish a foundational understanding of the Hispanic culture, values, and beliefs. And we will discuss the ethical paradox for Latinx people face when it comes to the donation and transplantation. Our panel will share details about initiatives developed by OPOs, transplant centers, and state legislations to promote healthcare equity within the Latinx community and share best practices established to better serve the Latinx community in hospital and community settings. So again, thank you so much for that. At this point, I am in great honor and pleasure to present to you our panelists today. We have, first of all, we have a true friend and a longtime hard worker, Ingrid Palacios, who has been part of this mission of saving and healing lives through organ and tissue donation for the past 10 years. She is currently working as a multicultural community outreach program manager at New England Donor Services, where she develops cultural intelligent programs to provide education about organ and tissue donation and promotes donor registration within diverse multicultural and multi-ethnic communities throughout New England. She's also a member of the New England Donor Services Social Equity Steering Committee, a member of the Board of Directors of the National Association for Multicultural Affairs and Transplantation, AMAT, a member of the DEI Committee at AOPO, and a member of the Diversity and Inclusion Work Group at the Organ Donation and Transplantation Alliance, where she was awarded the National Raising Leader Award. She graduated from the University Central de Venezuela with a bachelor's degree in international studies. And she has made it her mission to promote diversity, equity, and inclusion in all areas of her personal and professional life, and completed the Diversity Inclusion Program at Cornell University. She's also a proud mom of two Shih Tzus, Coco and Luna, and lives with her husband Mark in the town of Wayland, Massachusetts. Welcome, Ingrid. We also have, and a great pleasure of, and a true friend also, Jennifer Aguilar, a community outreach specialist at Gift of Hope and Tissue Network. And her role is to provide public education and awareness on the importance of organ and tissue donation in Illinois and Northwest Indiana. For the past 6 years, Jennifer works with a focus on working in the underserved communities to bring much needed information and dispel myths and misconceptions that prevent people from registering as organ and tissue donors. She had led various initiatives in Chicago's historic Latino communities to create awareness for organ and tissue donation, and one of them being the Light It Up Purple campaign, which lit up the iconic Little Village Arch and Pilsen Plaza Tenochtitlan with purple lights and banners during the month of April to celebrate National Donor Awareness Month. Jennifer was born and raised in Chicago's Little Village neighborhood, where she currently resides. Her biggest passion is giving back to her community through her work with Gift of Hope, as well as her service as board secretary for the Little Village Chamber of Commerce and board of directors for the Little Village Community Foundation. Jennifer also serves as a board of directors for the Association of Multicultural Affairs and Transplantation and is founding member of the Paul University Latinx Alumni Chapter Committee. Jennifer holds a bachelor's degree in political science and history from the DePaul University and is currently pursuing a master's degree in the same university and in public policy and strategic writing and advanced for nonprofits. She graduated with a certificate from the DePaul University School of Public School. Welcome, Jennifer. And last but not least, I'm very proud to pronounce and introduce Dr. Catalina Ramos Hernandez, a fellow doctor from Mexico, and she has extensive work from ITF administrative experience with health equity nonprofit organizations such as the UIC Institute of Minority Health Research, the Robert Crown Center for Health Education, and the YME National Breast Cancer Organization. Dr. Catalina holds an MD degree from the University Nacional Autónoma de Mexico. For almost 30, Ramos has advocated for health equity and represented immigrants at local and national levels. Her portfolio includes managing the premium support programs, screening new ITF patient applications, developing relationships with the transplant centers, social workers, and financial counselors, and leading ITF patients events and community education about the fund. So again, Dr. Catalina, bienvenida. Welcome to our event today.
Thank you.
So just to get everybody in parameters with our learning objectives, here's what you should be expecting today. We will recall relevant data and current demographics and barriers that prevent the Latinx community from becoming donors or having access to transplantation. We'll try to describe the Hispanic culture, the values, and beliefs in the relationship to donation. We'll also consider explaining the ethical paradox regarding Latinx people and the undocumented community in relation to donation and transplantation. We'll look into the initiatives developed by OPOs, transplant centers, to ensure Latinx and undocumented communities can not only become donors, but can also register as donors and have equitable access to transplantation. We'll look into the financial programs created to increase access to organ transplants by targeting the inequity of health insurance access. We'll also share with you best practices shared to address common barriers and effectively serve the Latinx and undocumented community in hospitals and community settings through education about organ donation. So a lot to serve into this event, but at the same time, look forward to seeing your comments in the little chat box. So let's start it off with, let's say, who are we as a group? What am I? So Jennifer, could you start us off?
Who am I? So that's a question that there's has been a lot of discussion recently. What terms are preferred? You know, that's one of the questions we received as well. What terms do I use? Latino, Latinx, Hispanic, and there's differences between them, and usually they are used according to personal choice. There is a very generational aspect of the names. Latinx is more of a millennial, you know, younger demographic kind of term. And I've heard a lot, you know, a lot during Hispanic Heritage Month about changing even that term of that celebration. Latinx is meant to be inclusive of different genders and identities. And it's meant to represent the Latino community as a whole. Hispanic is more of a historic term that has been used for census purposes, going back to the 70s. And it mostly focuses on the language. So that's what makes everything different. The Hispanic usually means that you are from a Spanish-speaking country, and that would include Spain. So someone from Spain would be Hispanic. But if we're talking about Latino, that is more of people who are from Latin America or descendants of Latin American countries. So a person who is Spanish would be considered Hispanic, but they would not be considered Latino. And if I am from Mexico and I am a Spanish speaker, I would be considered either Hispanic or Latina or Latinx, and that would be according to my preference. So it's kind of like, you know, like your gender pronouns, that now we are giving people the option to identify as they please or as they see themselves, and the same thing would apply to this. You know, there's a lot of conversation out there about the politically correctness of Hispanic due to, you know, the recent movement of just anti, I would say, you know, like all the things that happen in history. So a lot of young people are rejecting that term. But if you talk to older people, to older generations, they embrace Hispanic. They don't see a problem with it, but feel more comfortable with Latino. I just saw a question asking about Brazil. Brazil, you would be a Latino because you are from a Latin American country, but you're not Hispanic because they're not Spanish speakers. They speak Portuguese.
That is correct.
But that is kind of like in a nutshell.
I want to add something real quick to that, because it is important for us to know, and for our audience, that Latinx is kind of like a newer term that is very much used here. We don't really have it even in a pronunciation in Spanish, so only it's being documented as being that only 3% of our community have even heard about that term or use it. So it's kind of up and coming, and it is important, but it's important that we know that a lot of people don't use that term or don't even know about that term in our community. I just wanted to add that there.
Definitely, as you mentioned, this is the newer term, Latinx. As I'm one of the older ones, I'm still using the Latino Hispanic. And at this time, Jen or Ingrid, what are all our values the same ones? Do we all value the same thing?
I would say yes. I think our base values, right? Happy Hispanic Heritage Month, everyone, by the way. I am, very proud and very happy to be here with these amazing panelists, with you, Sal, sharing about this, right? What are values? I think the most obvious and common one that people identify us with is familia, right? It's family. How we are a collective culture that love to be with family. We need to be in community. That's how we thrive. That's how we love. That's how we eat. That's how we do everything. And that's something important that you're asking, because connecting that to our topic, that's how we show up. Even in the hospital settings, and Sal and all of us know that when someone is sick or someone is, has been in an emergency, all of us show up. Not only family, friends, community, church, the dog, everyone is at the hospital. And that is something that is important for us as professionals in donation and transplantation to understand and embrace. I feel that that's one of the main values. So we are able to respect the Latinos culturally and be able to embrace and connect knowing these values. It's not, something that, I don't know, I think it's genetically ingrained.
Right, no.
That's how we operate. So that
Ex-
could be something that is common. I don't know if you wanted to add something else, Doctora Catalina?
No, definitely, you are totally right. Family is sort of a great value, I think, all across the countries from Latin America. And yes, there is a universal value. And also, that is something that you mentioned, and that is very important, that when you start a program or something, to think about where are you going to have meetings with the patients, because usually there is not one person coming to the hospital. It's going to be 3-4 people, maybe children. That is very important, that the majority of people don't feel comfortable leaving the children behind. They are like part of the whole family. And also that you will be receiving a lot of questions from other members of the family. Usually as a medical doctor, you are used or you are sometimes taught to talk to the patient only, that everything is confidential. Among our families, I should say that for the majority of us, nothing is confidential. The health of one person is the community health of the family.
And the power that the elders in the family have. They might not be the legal next of kin legally, but they are the authority in our families, and only involving our elders is that we as professionals for donation and transplantation are going to be able to achieve our goals and provide better support and service.
Yeah. Go ahead, Dr. Ramos.
Yes, one last thing, that the family is not always the blood-related family. There is the comadre, the compadre, the neighbor, somebody that actually a lot of links are created during immigration. So one person comes to a family, stays with them for a year or two while getting themselves together. That becomes part of the family.
Satio,
yeah, well, the neighbor, yes.
Yeah, and as you touch the topic of immigration, we see an influx of immigrants coming from many countries, and they're coming here with a purpose of bettering their families, bringing back something to their own families in their own original countries, and at the same time they find themselves with this incredible country that offers so much, but limited to those who are undocumented, and healthcare, and the ability to actually access this is incredibly low. And sometimes it could be a language barrier, or is it something else that we're not seeing? What do you think, Dr. Ramos?
There are many aspects. I just want to touch base back on the values, because yes, family is a very universal value, but we are very diverse. And we come from different educational backgrounds, from different geographical backgrounds. There are some people that come from the city. The majority in Mexico, the majority come from very, very small towns. We have different religions. Even the accent, sometimes people do not understand between each other, because we have a heavy accent, or we have terms to point out to something that is just in one region different from the other. So that is very important to remember, that we are homogeneous in some areas, but we are very different in some others. Now, why people come here and how they come here? There are some people that says that they do not cross the borders, but the borders cross us. And the reason why is because many, many years ago, it was part of Mexico, or even some people, when we talk about the terms Hispanic, Latinos, there are some people that they prefer Hispanic, especially in some South states, because they say, my family came from Spain. We didn't come from Mexico. So they never recognize Mexico as a country. They recognize Spain, and they want to be Hispanics. And immigration has been up and down. Unfortunately, there are some economical situations that actually say we need some labor, we need to have more people, so they allow people to come, and Mexico is just across the border. There are family ties, and some people say, hey, there is job in this area, so bring your family. So they start bringing people from other countries. And there are some times that the times go difficult, and the lawmakers said we do not need so many immigrants, and just start the anti-immigration movement. So all of that needs to be taken into consideration, because there are some times that you can talk about very openly about serving undocumented people, and there are some times that you just need to be careful about serving undocumented community.
Right, definitely. Jennifer, can you comment on that also in reference to data or information that we have shared?
Yes, well, the influx of immigrants from Latin American countries is constant. And as we're seeing currently with the situation in Texas and the busing of new refugees into various big cities, shows exactly what has been happening, for years. Most of the immigrants that are here are settling in around big cities across the country. But what is changing is that with the need and demand for jobs, especially in the agricultural field, we're starting to see a lot of these refugees and a lot of these immigrants relocate to more rural areas and smaller towns around farming opportunities or factory opportunities. So we're going to be seeing a constant change in demographics throughout the country. It's not going to be just stereotypically the city as it has been. But yes, this topic matters a lot with us in various aspects. It impacts what we do when it comes to registering people to become organ donors, when it comes to transplantation. Immigration has a big role to play. And one of the biggest barriers that we face, as the undocumented community, is the lack of access to affordable healthcare.
Right.
That is the biggest problem, the biggest barrier that we have. And why is that? It's because, unfortunately, of the undocumented population and even just the general Latino population, we are the racial group that is most uninsured in the country. 42% of undocumented people are uninsured, and it all has to do, because of the legal status. Their legal status prevents them from qualifying for affordable healthcare options provided by the federal government, such as the ACA market and Medicare and any other benefits that come from the federal government. So that makes it really hard for them. And then the second barrier that is directly tied to that is low income. 44% of the undocumented community in the United States are considered low income and live below the 200% poverty level. And that means that they cannot afford to purchase private plans, private coverage. And if their employer does not provide it, then they're pretty much out of luck, and they have to depend on other sources of care, such as community clinics, and sometimes even just foregoing medical care altogether, which we saw during the COVID-19 crisis. The Latino community was the highest impacted because of that reason, because of the lack of access to healthcare coverage, and all the other things that we've talked about, such as our strong ties to family. We couldn't isolate, just living together in small quarters, and also impacted, by the low income of it all. So it's kind of like a combo for what we see when it comes to the transplantation of this community.
Right. No, I can see those numbers. And someone asked if you could clarify that 42% of documented and undocumented immigrants as uninsured. Are they uninsured? The 42%?
Yes, 42% of undocumented immigrants are uninsured.
Okay. And Ingrid, in reference to this contributing society, I've heard it many times where they've said, well, they don't deserve getting a transplant, or they shouldn't even be there. What do you think about that, Ingrid?
Let me read.
Yeah.
I just feel like, we need to also talk. We're not talking about small numbers here. We're like the fastest growing population in this country. We are 60.1 million. 19% of the US population is Latino. So let's start there. Secondly, also, when we're talking about undocumented, what's being documented, if you will, is there is almost 12 million people living undocumented in the United States. There are research and investigations that said it's even double the number, or sometimes it's say triple, but they're not being, that information is not being documented. So let's start there. We're talking about a big part of us being impacted. And so for our field, I will even take it to, and that's what we named this talk, the Latino Paradox. How is it possible? And this is a question that all of us as donation and transplantation professionals receive, I don't know, weekly basis, maybe sometimes daily basis. How is it possible that undocumented people can become organ donors anywhere, everywhere, every day, but we are unable to receive an organ or be even listed to receive an organ for living donation or deceased donation? And this is something that even for us as professionals, it is not an easy, it's a very complex situation. And I say this before, I feel when I started working in the field of organ donation and transplantation, that's why probably I gave that side, because this is something that is very, very close to my heart and made me feel as a Latino leader, as a Latino professional, ethically, morally compromised sometimes, and unable to give the answers to my community even when I'm doing, media or I'm being interviewed and I get that question. For us, it's difficult to explain it, to even understand it, let alone for someone, a mom of a pediatric patient that needs a kidney and is, low literacy, lives in a farm, has 7 kids, and doesn't know where to go because of language, because of low income, because of knowing how to navigate the healthcare system here, because of all the barriers that come. Our people work 2, 3, 4 jobs here, like Jennifer was mentioning, and Dr. Catalina, the industries that we are very risky industries where our population is working. So I am gonna talk about health justice. I'm gonna talk about social justice for these people. What are we doing? I say before, I have, for the longest time, just like cross my arms and say, well, I cannot do anything about it. You know what I mean? I'm in the organ procurement side. That's the transplant side. That's the federal government. But if we don't talk about this, how things are going to get resolved? We are talking about humans here. This is nothing to do with political or what we think is right or what we think is wrong. This is about being human. These are human beings that live in this country, that pay taxes, that are putting food in our tables during the pandemic, after the pandemic, before the pandemic, and are going to continue doing it under terrible circumstances, being discriminated. And we're not talking only about undocumented. And so that is my answer. We need to wake up, and it is all of us problem. So let's talk about it and let's see what we can come together, because I believe in the power of change, one by one, little by little. And that's what I feel so honored to, that we are having this conversation with you guys and answering everybody's questions the best that we can, because we're all learning. We are all learning, and we just want to bring this issue to the forefront, candidly, respectfully, honestly. So, yeah.
Yes, and then to build on what Ingrid was saying, and I guess to expand on it, it is not that UNO's policy says that non-citizens cannot receive an organ. Policy allows for undocumented people to receive an organ. What is stopping them from receiving it, from being listed, is the lack of affordable health insurance coverage. So it all goes back to that, because as we all know, the transplant process is extremely expensive, and because of ethics as well, to care for that gift that an organ donor gave, for that precious organ, in order to be able to care for it, we have to have the proper health insurance to be able to pay for post-transplant medications for a lifetime, and for care and for everything that is encompassed. And not being able to have that coverage, that prevents them from even getting on the list. And the people who are able to get a transplant sometimes crowdfund, they fundraise, and it's a crazy amount of money for people who, again, are under the 200% level of poverty, and they already have to work 5 jobs, and their families are doing everything they can to raise this money, but time runs out. We all know how delicate kidney failure or organ failure is, and sometimes we don't have the time to wait to fundraise, and that's kind of the biggest issue, is, again, that healthcare coverage access.
Exactly, exactly. Dr. Ramos, I'll give you the opportunity, but as you go into your comment, I'd like to see if you can actually explain what is the undocumented patient in a need of an organ transplant. What does their profile look like? What
Yes.
is it? Yeah, if you could actually, I think I jumped the gun on that, but I just wanted for the perception of the audience to know that I want to get an idea of what does this patient have to go through, and what are all the barriers or hurdles that they have to go through.
Yeah, thank you. Thank you for that, because I was thinking while Jennifer and Ingrid were talking, I said, yeah, this is a health equity issue, definitely. And also the affordable care didn't give us it's not affordable. It's just paying 800 to 1,700 a month for medical insurance. Is not affordable even to people that have regular jobs and well-paid jobs.
Right.
And who are these patients? These patients are not newcomers. Mm. The average years that they have lived in the US is about 28. And I'm talking a group of patients in the state of Illinois, the whole state. So 20, that means that some of them came very young to this country, very healthy. And after so many years, it happens to the whole community, some of us get sick. Also, this is a very young population. The average age is 40. So some of them start working at the age of 16, 17. and very few people are older. They do not get benefits in most of the states, and they make the average amount of money is about $900 a month. Most of them have families. The average number of children is 2 children. Sometimes we think, oh, Mexicans, Latinos have a lot of children. What is it that they have 7 children if they cannot afford? That might be a misconception, because we have the average amount of children is 2, 3 at the most. So they work in jobs that do not provide medical insurance. They are at risk. Many of them have been exposed to many chemicals and at risk. Many of them said that they are not allowed to drink water, because if they drink water, they need to go to the bathroom. Yeah, so what is going to happen after years? The damage, there is going to be some damage in the body. Most of them, as Jennifer mentioned, they do impossible things like selling tamales, doing a small kermesse, doing something to get the money to pay for the insurance that is not affordable. And what we can do, later on, or you want me to start, we can talk about a program that actually is where I am very proud to represent, because it's bringing hope to some people that are just waiting to die. And when you get that at the end of the day, you know that your day is worth it. You know that you are doing something right. And it's not about feeling sorry for this community. It's just about equity. If people work, they deserve to have access. And most of these people are people that actually pay taxes. They contributing into Medicaid, Medicare, knowing that they will never be able to get the benefits from that.
Yes, Dr. Catalina, your work that you've established in Illinois is exemplifies what other states can do to help our own community. Ingrid, do you want to comment on this access, affordability, and availability?
Yes, I want to comment about another paradox that I came to see and to learn about. How is it possible that states like, for example, North Carolina, New York, provide, and other states provide funding for dialysis and emergency dialysis, which in the longer run is much more money than funding for transplantation. Yeah. So it's another thing. So there's so many things that can be done. And we have one of the most amazing organ donation and transplantation systems in the world. We just reached the 1 million transplant, that historical milestone. We are leaders in the world, but we have a long way to go. So it is important to see these dichotomies, this, you know, in one side, there's millions and millions of dollars being paid on emergency and on dialysis treatments for undocumented people, but then these same states refuse to pay for transplantation, which can be, you know, a very effective treatment for the disease, especially for Latinos, that we are almost, what, two times more prone to renal disease or liver disease or high blood pressure than white Caucasian, the Caucasian race. So that was something that I wanted to add there to what Dr. Catalina is saying.
Great, thank you so much.
Sorry, Sal.
No, go ahead, Jennifer. I was going to give it to you.
That triggers.
Please, it triggers everyone. I can imagine. Go ahead, Jennifer.
I saw in the comments, you know, Glenn made a great note about that we must remember that non-citizens are also organ donors. Yeah. And that's something that's where the paradox comes from as well. You know, that this community they donate when they have the opportunity to do so. And although, you know, the barriers for them to register officially on state registries are that a lot of them cannot obtain legal documents such as an ID card or a driver's license in many states. So they cannot register their intent officially. So we may not know those numbers based on that data. However, we have this very old number from 2013 that says that about 3% of all deceased organ donors were undocumented. But again, that's, almost 10 years ago, and I'm pretty sure that number has gone up, especially because there is data for states that have instituted temporary driver's license programs, which provide undocumented people with the ability to take out a driver's license. The state of Illinois is one of those states. In 2013, they instituted the temporary driver's license program, and someone did a study to see the effects of the program in the registration numbers of the organ donation program. And we saw that the numbers skyrocketed. So 44.9% of the people who took out these temporary driver's license, who were undocumented, registered as organ donors on the spot. 44.9. And that is compared to 7.3 registration rate of the general public. So we are willing to give, and we will give when given the opportunity. And I know that this is a big, issue we always hear, especially in community outreach, like, oh, well, they don't, this community doesn't donate, Latinos don't donate, or their beliefs, or, and in reality, people know when they aren't being treated fairly. They know when we're sugarcoating things, when we're giving them the politically correct answer. And that reflects when we have those conversations out in the community, at events, at hospitals. It reflects, and they will let you know, why should I donate my organs if my cousin needed a kidney and they told him he couldn't get it because he didn't have papers? And that's something I hear every single day out in the community. And it is a fire that I have to put out or address. Like Ingrid was saying earlier, we go on media, on Spanish media, and we get asked this question, and we can give, the politically correct answer that is, well, undocumented people can receive transplants, but it's the lack of health insurance. But again, like Ingrid was saying earlier, when do we do something about it? When do we just stop giving this answer and actually work towards a change? And I'm very lucky and very grateful to be from the amazing state of Illinois, who is leading the way, first with the Illinois Transplant Fund being established, and the passing into law that undocumented people could receive organ transplants in the state of Illinois. And then now, during the past 2 years, since the start of COVID, we have instituted the expansion of the state-funded Medicaid program to cover undocumented people ages 42 and up. So that has helped the state immensely, and this community immensely, and it can be done. And it took a lot of advocacy. It took a lot of community union and work, and and leadership from at the time our CEO was Kevin Smunt, and he was a great leader of this movement who worked and did everything in his power to address it, because he knew that it was affecting the work that we did as an OPO. It was affecting authorization rates. It was affecting registration rates. People, especially activists, saw it for what it was. The lack of equity. And again, whenever we have these types of interactions with people, or we send a family away without giving them the access to a life-saving transplant, they will go on and spread the word. They will tell their whole extended family, their friends, don't trust them, don't donate. And we get those stories constantly. It's not just from close family members. Word of mouth is the biggest outreach tool we have in this community. And we have to put our money where our mouth is.
Yes,
Yeah.
exactly. And I'll refer to you, Dr. Ramos. It is incredible the need for this access. And
Yes.
and Glenn mentions also that at the OPR here, exactly where we work, we work with the consulates from many of these countries who have actually opted to identify their citizens, and they also have some countries like Mexico have already
The
instituted
matricular.
La Matrica Consular, and they have actually said, and you can see it in some of the modern ones, that they are donors. So in itself, many countries from afar are already thinking about the ability to give. As mentioned by all of you, we're a very giving community. We're willing to give. Give us an opportunity to receive that equal health care, and believe me, you will see that. And especially with those states that do have the driver's license ability, because they know how important that driver's license is to them. They not only give them an opportunity to go work, but at the same time to contribute to that state's funding. And obviously, Dr. Ramos, you have a special project that maybe you could exemplify how that worked in Illinois, as Jennifer was mentioning.
Yes, yes. And I'm going, yeah, there is one question about if any states cover transplant. Actually, here in Illinois, some of the transplant centers were willing to do the pro bono, the transplant. However, that is not the main problem. The main problem is about the cost of the medication, anti-rejection medication that is going to be for the rest of their lives. That is the main reason, because no transplant center want to put one organ in a patient that actually cannot take care of that. And for that, in this situation, is very needed the medical insurance. And as Jennifer mentioned, ITF, what we call it, Illinois Transplant Fund, start because of the work of many people that were denied organ transplantation. They got together, they went to the transplant centers, they got with the elected officials, and they were able at that time to pass one law that actually will cover the transplant and the medication for patients in Illinois. Political changes, the money was just put aside and that disappeared. That is why when the then director or CEO of the Give of Hope decided to get together with the transplant centers and start talking about what they could do. The easiest way was to get medical insurance for these people. Affordable Care Act was enacted in that at that moment, and that allowed people to buy medical insurance. It's very expensive, but still, it's cheaper than paying for the transplant and paying for the medications. And what we do with the Illinois Transplant Fund is to pay for the premiums of people after the transplant. So there is one association, one national fund that actually allows people to get through the evaluation and the transplant is American Kidney Foundation. A lot of, and as Jennifer mentioned, yeah, there is money to pay for dialysis. And there is a lot of money, states pay for dialysis, some better than others. Some of them pay for emergency dialysis only when it's needed. Some others is like Illinois, we are very grateful that pays for consistent dialysis, not only as in emergency cases. And American Kidney Foundation pays medical insurance, pays the premium support for people who are on dialysis to cover other expenses. So based on that model, Illinois Transplant Fund was funded and we paid for the premiums. With that, now people have the possibility to go to transplant and then continue with the medication for 3 years. And then we start working with them. But it's not just paying for premium. It's about working with the transplant centers. It's about working with the dialysis centers. It's about working with the patients because, yeah, there is a language barrier in the majority of them. There is also the need for the family to be involved because they are going to be out of work maybe 2 or 3 years, 2 or 3 months, and then start working little by little. There is a lot of emotional support that they need because, as we said before, the families, the Black families might be out of the country and there is a time that they feel very lonely. We do big amount of work with the transplant centers. Some of them hire people who are bilingual, who are bicultural, who are sensitive, to help them to go through all this. It's not an easy step. There is a lot of education. There is a lot of networking. We also work with other organizations to provide the psychological support if that is needed. Sometimes they do not have anything to eat, so we work with a lot of community organizations to get these patients back to work. The whole idea of supporting these patients for 3 years, almost 4 years, is to assist them, to help them to get on their feet, because we know that the majority of them are going to go back to work. As we said, this is a very young community, 40 years of age, so maybe another 30 years, 35 years of work that they can be productive instead of being on dialysis. Talking about the paradox, the majority of our patients, when they came to ITF, had been an average of 18 to 20 years on dialysis. They are poor, they are overworked. However, for some reason, they are healthier. And also, we have a small amount of people. We have about 600 applications, over 600 applications. Almost 400 people have received an organ, and we have maybe 5 people that died for complications. The other 3 or 4 died from COVID, and other 2 died in accidents at work. So we do not have a rejection, a huge rejection. This is a small sample. I want to clarify that. But that is the paradox, that for some reason, we survive Latinos in a very difficult situations. And we are very proud that the activism of people got us to ITF, and they kept working, because at one point we said we are not able to continue supporting because we need more money. And the state decided to work to cover post-transplant kidney patients. So any age, if there is a patient that actually is 100 or 120% below poverty level, they are going to be covered for Medicaid services for the treatment of the post-transplant. So that is amazing, because now there is not only waiting until the age of 42, but it's also these people might be younger. And then people start working in the state also about the 65 and older, and the 42 and older. Right now is you are 42 and older and you are poor, you are being covered for full Medicaid. But if you are younger than that, at least you are going to have access to the medications and all the post-transplant services needed for these patients. So it is amazing and could be done. It's not a lot of money when you talk about saving about 375 lives for $1 million a year. I don't believe that is a lot of money.
That is correct. Dr. Ramos, thank you for leading, being part of that as Illinois has demonstrated, it can be done, as we say it in Spanish, sí se puede. The thing is, obviously we can see how important this is, and I'm seeing that there's interest in all this. How can we mimic this? How can we share all this information? How can we do this in California, in Florida, in Texas, New York? What are the parameters, or what do we need to do to make this happen?
I think that you need to have a champion, a leader, a person that invests the time and that cares, and then people start getting together.
Very good point. Yes. Ingrid, your thoughts on this?
I wanted to ask actually Jennifer. Jennifer, remember, and I think that there is questions about that in the chat, and I would like to like rephrase that question. It says, what other states allow undocumented persons to receive organs? Or what other states actually are, working towards health equity and social equity to help these vulnerable populations? And I know you did some investigation, some research on this, right? With California, I believe. If you can share that with us, Sal.
Yes,
Sure.
so again, undocumented people can technically receive an organ in any state,
Mhm.
but it is the lack of affordable healthcare access. And the states that are working to actually improve the access and to give this community access, California, they have passed legislations and are planning to institute them in 2024, and it would cover all of the undocumented population, from children and older. So it would be a universal kind of coverage for this community. And like I mentioned, Illinois, they spearheaded this movement in 2020, first by passing the Health Benefits for Immigrant Seniors program, which initially covered ages 64 and over. And then there was a second expansion to that program, which became the Health Benefits for Adults program, which covered, at the beginning, I think it was only 52
At
to
one point,
the
yeah.
65, and then they did a second expansion that is now 42 and up. So now we only, and then Illinois was also the first state in the nation to pass healthcare coverage for all children, regardless of their immigration status. So children in Illinois have been covered since 2009 up to the age of 18. So now we just have a gap from 18 to 42. And that's where, programs like the Illinois Transplant Fund come in to help us. And the other program that Catalina had mentioned. But other states that are doing something about it are Oregon. They're starting to pass the Cover All People Act, which will extend state-funded coverage to low-income adults who are not eligible for affordable healthcare access because of their immigration status. And that started July 1st of this year. The District of Columbia is also working for their locally funded Healthcare Alliance program, which was created in 1999 to allow coverage for low-income residents regardless of immigration status. And Colorado is starting a similar program in next year, and they will cover low-income residents below the 300% poverty level, who do not qualify for other healthcare options due to their legal status. So those are the states that are pursuing more comprehensive reform for healthcare access. However, there's other states that are instituting smaller programs, first steps, covering children and pregnant women. And a lot of them, are big states with big undocumented populations, such as New York and Massachusetts also has a program covering children and pregnant women. Connecticut, Washington, D.C., New Jersey. So there is some movement in this area, but the biggest leaders are California, Illinois, Oregon, and Colorado.
That's great to know. Yes, Dr. Ramos.
There is one question about living donation on the chat. And yes, I want to talk about just our program. Again, it's a small sample, but at the beginning, from the inception, 2015 to 2019, we had 43% of people who received a living donation. Then COVID hit, and of course, the numbers went down. And also something different happened here because we have more access to organs. So a lot of transplantations happened between 2021 and we went to 29%. But yes, I think that there is something, and Jennifer does a lot of work about some workshops about living donation. And of course, when we receive a patient in Illinois Transplant Fund, we talk about that. That is one of the first questions. And we do also a lot of work with the consulates. And we, in the presentations, we talk about living donation just to educate the general population about the possibilities of donate in order.
Great. I just want to also add to our audience that Glenn has actually added into the chat the 2019 summary of non-US resident transplant activity link and the OPTN ad hoc International Relations Committee of 2021, where there was a meeting of the citizenship status guidance document. These are documents that also will be provided to you in the toolbox that the Alliance also has, as many of the resources that we'll also be able to share as we have spoken today in reference to some of the solutions that can be offered. And obviously the expertise that we have today are just incredible, and I'm incredibly honored to hear all this. There was one question earlier and says, do you value or do you think it's important to have all this information available in their native language? Because they may not have the information translated. I mean, it's great if you have it, but if you can't read it, you know. So do you think that there's some value in investing into having multicultural or multi-ethnic personnel, staff, documentation, grief packets, whatever this may be, to help our community understand how they can actually access this?
Most definitely. I think I'm very passionate about this topic, about the need for being equitable when providing services to this community, especially when it comes to language, and not just language, cultural sensitivity, cultural competence, because it's not just the fact of, you know, translating word for word, because again, just with intentions, people can tell when something was just translated, and it's not curated to them, it's not crafted for them, it wasn't carefully done, considering their culture and something that they will receive effectively. I saw a question on the chat asking or mentioning that they hear often families who signed up for the temporary driver's license programs and maybe they didn't know what they were signing because there's not information about what it entails to become an organ donor in their language, or maybe it's not provided at registration sites such as Secretary of State's, and then I think that that's one of the biggest issues. How do we educate a community if we do not have the proper resources to do it? And you know, we're grateful as a member of AMAT. We have the Latino work group of Latino OPO professionals and transplant professionals, and the passion of my colleagues is amazing, and they go above and beyond to make sure that the community has these resources, that they have this education in a culturally sensitive manner and also in their language. However, most of the time it's out of our own initiative. It's out of our own time and resources, and almost in a volunteer way. And it would be great to see more support, you know, more support with more staff that is bilingual and culturally competent in all the main areas that we would need, such as authorization, community outreach and education, donor family aftercare, because all these things impact registration and authorization. You know, aftercare, you know, a lot of people wouldn't think about it, but again, like I said, word of mouth is the biggest marketing tool in our community. And if someone has an amazing experience where they were cared for in a culturally sensitive way, and they were made to see what a great decision or what a great impact being a donor family has made in their life and for their family, and how it has helped with their grief, they will recommend that. They will tell their loved ones and family and friends and whoever will hear them about the amazing work that OPOs do and about the amazing thing that it is to become an organ donor. However, if there's no staff that, aftercare staff that speaks their language, they will likely be missed. They'll likely go unreached. They'll get a letter, and won't be able to understand it. And or maybe they will, but it's much more than that. It would be more effective to have the staff that will be able to truly serve them and provide the aftercare that they needed. And that is really impactful when it comes to encouraging others to become donors. And even when it comes to volunteers, to building a Spanish-speaking volunteer base for outreach and education activities. We have to have someone to cultivate donor families and transplant recipients to want to join us and in spreading the word and getting others to register. So it's all kind of connected.
Right, definitely. I think that it's very valuable. And at the same time, part of the chat information, it was asked the investment of our own interpreters, because an interpreter could only interpret it depending if it is someone knowledgeable or passionate, but they can even have their own bias. So we have to be careful how we use these interpreters, how we train these interpreters, how can we get these interpreters to be fully informed and educated and culturally sensitive to the need that exists. So definitely investing in our culture, in our community, in our ethnicity is of great value. And Ingrid, any words on that?
Yes, I actually wanted to echo everything that you guys are saying. I'm like, yes, yes. And also like our organizations and transplant centers need to be intentional when hiring people, like Jennifer was mentioning, multicultural staff, bilingual staff, because it seems like that is something like if it happens, great. And if it doesn't happen, they continued only translating and creating programs that the people are not relating to. You know what I mean? Like, how would you have a mere translation of program that works culturally different for white population, but then you have someone that is not of color leading diversity, equity, and inclusion programs or multicultural outreach programs or creating things and making suggestions or making changes in what you are developing as a person of color for your own community. Those are things that OPOs and transplant centers need to be intentional. We need to represent. We need to leave our comfort zone and have these uncomfortable sometimes taboo, stigmatized conversations in order to make changes for our community. What we're looking here, what we're seeking here is to bring this subject, and I say it again, to the forefront so we can come together as community of professionals in donation and transplantation and truly make the changes. So that's what I wanted to add.
Definitely. I can see, and I'm hoping the audience can feel the passion that every one of us have in this. We're not in it for the money, to be honest. We're in it because we believe in the cause. We believe in our community. We believe that we can make a difference in everyone's life. So I applaud everyone. Yeah.
Yeah.
So, sorry. As we go on, we have other questions in reference to recommendations. Any recommendations at this point in time? Let's start off with you, Dr. Ramos.
I think the recommendation is very broad. Find the people who are interested in helping this community and help them to achieve this. Very, very simple. There are going to be someone, there are going to be, fine if your transplant centers have any resources, find the OPO, find the people in the community, someone that is invested in this cause, someone that is willing to help. And then if you need more also, educate yourself, ask for help, may network with people that actually have similar care and see from that, because it is not easy. I know when you look at this, you need to work with interpreters, you need to work with transplant centers, you need to educate the community, you need to educate yourself. And you said, where I start? Get together with someone about interpretation. Yes, when people ask me, do you prefer English or Spanish? And I said, let me hear your Spanish.
I do the same.
Sometimes they are going to talk to me and I will not be able to understand.
Understand, yeah.
Right.
So in Illinois, you need to be certified to be a medical interpretation or law interpretation, which is different. So invest, and get together with people that care about this, and start moving someone.
Perfect. Perfect. All right. And Jennifer, your comments.
Yes, I guess my biggest recommendation or call to action would be for OPOs to really consider how the population is changing, and how by 2050, 1 out of 3 children will be of Latino Hispanic descent. So our community is growing, and we will become the majority in some states, and that will soon spread. So I want to encourage OPOs to build their capacity to serve these communities by hiring staff that speaks the Spanish language, that is culturally competent, and that is able to connect with this community in order to achieve our goal, which is to save more lives and enhance more lives as well. And I think to do so, like Ingrid was saying, we must put our preconceived notions aside and really become culturally humble, and know when leaders aren't it's not their specialty, reaching to this community and acknowledging that, and seeking someone who is a subject matter expert, who is capacitated to be able to do the work, and to trust them whenever they give recommendations or when they propose initiatives, to trust them instead of sticking to the, well, this is how we've always done it, or this is how we're doing our general market marketing or general market outreach or general market authorization. So we want to stay in the same track, but you can't, you just cannot. And we must really divorce ourselves from trying to do that. If you have messaging in English, it will probably not work the same way or have the same effect in Spanish. Therefore, it will be okay to have 2 different messages for maybe the same campaign. But those are the things that we have to be open to.
That's incredible. I can't say enough of how important that value is, especially in the 30-year sums that I've been doing this. I can't say enough how important having 2 messages geared to our communities is incredibly, because it just doesn't resonate. It won't come through. And if the objective is to help our community understand, obviously this is going to be a great need. Ingrid, comments or recommendations?
Yes, so Jennifer was saying everything that I was thinking, because it's not enough to hire bilingual, multicultural Latinos or other cultures or other races to come and serve a community. The organizations also need to empower, nurture, mentor, promote us.
Yes.
Notice, recognize the work that we do, because sometimes it's only 1 or 2 of us doing the whole thing, serving the whole DSA. And we do it because you can see the passion and the love that we have to serve our community. However, it is always so helpful and so valued by us to have the support of our organizations, to know that our organizations are backing us up, are helping us to develop resources, programs, and are listening to us. So that is something that I have been lucky to be able to have in New England Donor Services, where and I wanted to talk about this as a recommendation for other OPOs are like, well, where do we start? You know, you start with a wish, with a goal, with a vision, with a desire. And then you go and ask for collaboration, like we do everything else at the hospitals, everywhere else. I was able to have, say, and something that it became something more complex, but started simply by asking, why don't we have Spanish platforms in social media? Can we create one? What does it take? Or here we are in New England, and I did my research, we're 1.7 million of Latinos. Why we're not serving them? How can I help? Let's do something about it. And then in 2018, we launched, and I manage those, that platform, Social Media Donde Vida New England, which has been now a platform. It has become a community. You know, I have done so many things with families, the connection, and that is something that the communities appreciate. That genuine, respectful connection with someone that understands your culture, that treats you with respect, that is on your own, in your own language. The same that we launched in New England Donor Services, a Spanish website. We did it last year through the umbrella of the Social Equity Steering Committee that after the killing of George Floyd, New England Donor Services established. And it was like, okay, we need to look into what we are giving to the community. How can we advance social equity and health justice to save lives? And I being that small part or big part in my heart to do and develop and say, well, why don't we do this? Why don't we do a symposium and bring, all these communities together so people can learn? Because education, and I always say, even when people challenge, what we believe or what we are trying to teach, I always say this is a moment that is a real-time opportunity to educate, not to engage, not to fight, but to educate and to learn together. So having that openness into listening, into baby steps, and then all of a sudden, and I'm speaking with a lot of pride because it took a lot of work, especially with the website, talking about translation. That couldn't be a Google translation. I had to do cultural adaptation of the whole thing. So when a Latino reads it, it's like Dr. Catalina was saying, how good is your Spanish? It not only sees the word there, but it's something that is respectfully written, that you understand and you relate and you feel dignified, that all the information that English-speaking families have access to, now our Spanish-speaking families in New England have access to in my OPO. So I just wanted to add like those couple of things that you can start little like that, and then you start building a community, and then you start getting all these people that are vibrating in the same, and want to do the same things. And that's what brought us today together here. I get like this whole time I've been getting goosebumps of like, how am I with these amazing people? The questions and engagement of our audience today is just so moving because the interest is in there. Let's continue getting educated. Let's continue giving back to our communities. It's not just about asking for them to say yes to donation, but it's also for us to serve with respect, with human dignity. That is something that we all want, and we also want to give.
Thank you very much. You took the words right off. And the important thing here is the respect and dignity that we can offer our services to our community and to our fellow colleagues that have been doing this for quite some time. Glenn does remind us that the NASEM report focuses on the equity of donation and transplantation, and that is actually available through the Alliance Community Resource Toolbox. So not to forget. As I read some of the questions that were given initially, what brought to my attention is how can I connect to the Latino community via cultural events such as Day of the Dead? And I'll tell you, I have seen Disney movie Coco, and I see the more I see it, the more I'm like, do the first thing, go watch that movie, you will relate to us at that point. And if you want to continue, then you could go into Encanto, the Colombian belief and the mystical thoughts that those movies bring to us. That's when you get it. That's when you say, oh, okay, now I know why they say what they say. And obviously this is my personal thought, but if of course anybody want to share here at this point, as the minutes are trickling down, more any other questions, I'm more than happy.
Personally, I think Day of the Dead is a great event to embark on or to invest in when it comes to outreach in the Latino community, specifically the Mexican community in the United States. I have done an altar at our Mexican Museum of Art here in Chicago every year since 2016, and it is by far the best outreach event I do. It is completely free. I don't have to pay to set up my altar, and it's in a community altar space, which means that all the families who have lost a loved one get the same opportunity to set up their altars honoring their loved ones who passed away. So people go to each altar and ask questions about the person, and when they get to mine, they see all the different faces. And then they see my Gift of Hope tablecloth, and they ask me, oh my God, were these people organ donors? And then I go and tell the stories of the people whose pictures I'm displaying, and talk to them about the importance of organ donation in our community, and how these people saved so many lives, and how their families had the strength to say yes to donation, or how they themselves had the ability to say yes to donation. And since our numbers, as Catalina was saying, the demographics of our Latino community here in Illinois are very young, we see a lot of young donors and a lot of pediatric donors, and that moves our community beyond belief. People can't believe that these little kids were organ donors. And in a way, if they aren't organ donors, they even feel like shame, like, oh man, maybe I'm being selfish, maybe I should be an organ donor. And I have some of the best conversations at this event. So I really encourage you to look if the Latino communities in your areas are organizing a Day of the Dead event where you can set up your own altar and really take this opportunity, because it's a great way to have one-on-one conversations. And it's the perfect setting because people already come with the mentality that they're gonna be seeing and talking about death. So you won't catch people off guard, or people that will, be scared to have those conversations since they're already in that mindset.
Yes. And I just want to add something. As a healthcare provider, you may not like the culture, you may not want to learn more, but at least to have respect. See everyone as they are. All of us are going to have different beliefs, and sometimes you go to see some events and you said, oh my God, that is not what I was expecting, it's different. But if you see each person and you listen to each person and you respect that person and you understand that that person is a mother, a father, is a relative of someone, is loved by someone, has experiences that are very rich and can bring something into your life, I think that you will be great. Regardless if you know about the culture or you do not know, if you know the language or you do not know, just having that respect for the person is very important.
Great.
Sal, I wanted to jump in just to insert a little plug. Our AMAT Latino work group will be having a cafecito and chat, which is an informal chat similar to this one, focusing entirely on Day of the Dead and community outreach activations that can be done during this celebration. It will be taking place in October, so please be on the lookout on LinkedIn and the AMAT social media pages for more information on how to register and attend.
Perfect. Ingrid, any last thoughts?
Thank you, everyone. Gracias. I'm very moved of the amount of people that attended our talk. Thank you for the support. Thank you for listening to us. Thank you for caring. Thank you for getting educated. And I hope that, we are able to continue talking about this as you were talking about Encanto. And as I was preparing for this conversation, not only today, but before, that song that we don't talk about Bruno came to my mind every time because we really don't want to talk about Bruno, but we need to talk about Bruno. We need to talk about this. We need to continue representing, being vocal, and being supportive of not only the Latino community, but all the communities of color that also deserve equity. So thank you very much to everyone. Muchas gracias por estar con nosotros esta tarde.
Yes, thank you so much, everybody. And I did offer to put it out there. I saw a lot of states, almost every state. We actually made it international. We had someone from Guanajuato, Mexico, present also. So it's like the interest is there. And I think that we're all available to help and help each other out. Our numbers is available for the presentation. If you have any questions, you could ask Dr. Ramos, Jennifer, Ingrid, myself. We're all here. You can see how passionate we are. And again, we are grateful for being here for this long time. We know your time is valuable, so we appreciate it. So again, thank you so much. Dios los bendiga. Thank you. Take care. And I think we're good. Deanna is no longer here, so at this point, we can still talk. Yeah, we could talk.
Just to remind them, they're going to be receiving a handout with some recommendations of some resources.
Perfect. Yeah. Oh, and there's Deanna. Okay, Deanna, take us out.
Thank you, Sal. Well, I can't say it any better than you did. And I just want to extend a sincere thanks to the entire panel. I mean, this was a fantastic discussion. I know myself, I personally learned quite a bit. And I stand with all of you in really joining this mission to make sure that we improve equity for not only the Latino community, but all communities of color. So thank you for all that you shared today. Just looking at the chat, I can see that a lot of folks who joined us today are very appreciative of the information that you shared. So I really appreciate you all taking the time. Just to reiterate a couple of things that were mentioned, I know my colleague Glenn mentioned that we do have a DEI resource page available to all of you that are still with us. And certainly you can share it with your colleagues on our website at organdonationalliance.org. You'll find it under the resource section under its own page entitled DEI Resources. And then in addition to that, our panel has done a phenomenal job at putting together a resource highlighting some of the recommendations that they covered during this later portion of the discussion. So we will get that out to all of you along with the recording from today's discussion. And certainly in that handout, they've all included their contact information. So as Sal mentioned, if you have any questions, if you need anyone to reach out to for additional insight or anything like that, I'm sure they're all available to you, and I appreciate you making yourselves available in that capacity. So with that, I just want to say thank you and enjoy the rest of your day, everyone.
Thank you.
Thank you.
Adios.
Thank you.
Ciao. Thank you.
Bye.